Most of the measures that are taken provincially.
Okay.
So it's our provinces that deal with our own epidemiology.
Okay.
So in Canada, I think we are doing fine.
Okay.
But in Quebec, we are doing not so fine.
Australia has an advantage in being an island and quite a remote island, geographically speaking in the
Yes.
world. So we've had some advantages there, but we've made use of those advantages by restricting access from international travellers, and also in Western Australia, we also restricted access at the state borders. So on an international level, any Australians who are overseas, they could return home, but we weren't allowing non-Australian citizens to come into Australia, and that had a big impact in reducing the number of cases in Australia, because most of our early cases were from travellers returning.
So Japan was one of the first countries outside of China to get COVID cases, and so it's back in January. So I feel like we've been on alert for a really long time.
Yeah.
But the Japanese in general, they don't have a lot of physical contact. So for instance, when you go to the grocery store, there's a little tray at the cashier, and you put your money in it or you put your credit card in it, and then you slide it over to the cashier.
Oh, wow.
And she takes it out. So there's really no touching at all. So it's very interesting with the physical distancing and everything. You don't really have to think about that much here. So I think that's helped with the spread.
On the 20th of March, the schools closed. So that was the first major thing. Up till then, they were kind of just saying, you know what, social distance, don't go out if you don't have to. But it was very, very chilled. It was very lax. And then on the 20th of March, they said, actually, no, we need to take a step now. So they closed all of the schools.
It was a bit weird for me because at first I looked at it from the outside because I was in England when all that happened. So I also have some family in Italy. So first I heard of the big lockdowns and the big problems in Italy, which was the first really center of pandemic in Europe. And so in the meantime, France was not really responsive to that, and it all seems like it would never happen to us.
Thankfully, in India, even though the government's decision seemed rash at the beginning, because not too much of time was given between the time when they first diagnosed this whole thing and accepted the fact that a pandemic like this had entered India, and to the time they actually shut the entire country down was done in a matter of hours.
Okay, despite what the news is sort of putting out there, saying this should have been done sooner. It's a situation like this is completely unpredictable in a sense, and over here right now, currently, we have the highest death toll in Europe. We have the worst, and people over here are still very against the idea of being stuck in their house, as I'm sure you guys are experiencing as well.
The measures got way more strict, which means that they issued also a curfew. You couldn't get out of the house except if you were holding your ID card with you, and also a signed document or an SMS sent to an official number of the government that, I'm this person, I live there, and I am going out of my house for this particular reason.
So they put restrictions on the number of people who could gather together. It went from 4,000 to 1,000 to 50 to 10 to no gatherings at all. We were put in a very strict lockdown because it also coincided with our holidays. And they know that people like to spend holidays with their families and with their extended families and with their grandparents, with the uncles and the aunts and the nieces and the nephews and everyone and the cousins. So they said, we can't have that right now. So we were put in almost full lockdown.
So we were for 2 months in a state of emergency, that's what we call it. And we left that state this weekend. So now you are in they call the calamity. I think that's the correct term, which means that small shops are opening up. We are still advised to stay indoors, but we are not obligated to do anything. It's more of a civil consciousness.
We have 89 regions, and they are all big, and every region has its own policy. For example, in my region, Sverdlovsk region, it's the middle of Russia.
Okay.
We have strict rules. We shouldn't go out, only to shop, to work, who is working. And I'm working last month at home.
Early kind of like restriction of travelers coming into Singapore, because we were kind of like a traveling hub, so we had a lot of people coming in, so we kind of like closed our borders from affected countries when there were a lot of cases coming out or popping up around the world. And then basically we just moved into our first month of what we call circuit breaker mode, meaning that we have our all kind of shops and malls are shut down, and only essential services are allowed to carry on things.
Well, here we began the lockdown in the first week of March, so everything was closed.
That's earlier than
All
the
the-
US.
Yes, all the works, all the schools, everything. The only things that were open was the police stations and the hospitals, nothing else.
Basically, Lombardy is the region that was hit the most by the virus, and here in the north, I'm pretty lucky because I live in a valley, so we don't have a lot of communication with the outside the valley, so that really saved us, more or less. So the virus arrived later. So we already had social distancing and all the lockdown going on, so that really saved.
It was one of the countries which really early started to test in masses.
Oh, wow.
So they have upped the diagnosis, and we have currently the situation that we could even do more tests which are not done. We can do twice as more as already done.
Flattening the curve is trying to relieve the burden on our hospital, our healthcare system. It doesn't really say too much. The idea is to try to reduce how many infections there are, but there will be a lot of infections at the end of this.
We have no quarantine, and completely nowadays everything was pretty normal. So we based it upon personal responsibility.
Yeah.
We're really starting to see the scope of the impact of this outbreak here in Leticia, and it either could be that indigenous people already have some, because there's many coronaviruses, and indigenous people still hunt for subsistence. They're still in more contact with wildlife than Westerners. So maybe they already have some antibodies that will protect them from this virus, or it could really wipe them out. And that's kind of like the worst case scenario.
My admin assistant has been going through like 4 different drugstores. Antibiotics will take 4 days to arrive.
What? Why is it taking so long?
It's all out of stock.
No. Oh,
Out of stock.
Because I was gonna say, like, you guys are the capital, so shouldn't you guys have stuff?
Not a guarantee. There's no stock because apparently, during the summer we also get a bout of the flu and some bacterial infections. So those things happen on top of COVID happening at the same time.
We've also got the added problem in this country is our extremely high HIV rate. People with HIV have already got pre-existing conditions. Then we've got a very, very high TB rate, and we've got a very high crossover between HIV, TB, You can just imagine what's going to happen to lungs if they've got TB and now they've got corona on top of it. So we have massive settlements like that with thousands and thousands of people living in there. And again, if it gets into there, we're going to suffer so much death. And that's what the government is afraid of.
The Amazon Department of Colombia currently has the highest number of reported cases per capita in the country, disproportionately affecting isolated indigenous communities who lack access to food supplies and medical care. If you would like to help, please donate and share the link below to the group FundMe. Thank you and have a great day.